In order to become a real pediatrician, you should be able to see in the C of 100 normal, the one that has Wilms tumor. Extenders can't do that. I am sorry.
Yeah, I think mine could, but I know what you mean.
I highly doubt it because I see it all the time.
Yeah, no, mine could for sure. She's been in practice with me for 25 years.
Oh, by accident, 25 years you're going to learn, yes. But the new ones.
Yeah. No, she could. And I know I agree with you. I think you're right.
If I worked with a neurosurgeon, I probably could become a neurosurgeon in 25 years.
Yeah, that's probably true.
We're not talking about that. We have to respect our own profession a little bit. And
Yeah.
give it away. We're giving it away to 23-year-old extenders that really have no experience.
Yeah.
I think the nurse practitioners, the physician assistants, if they work for a super subspecialty, in 18 months, they're really good at it. If all you do is round on neurosurgery patients and do all the post-op care in the hospital for all neurosurgery patients, in 18 months, a smart person can learn the algorithm.
Correct. But
I don't think
comes about her. They're allowed to, I'm doing this with a neurosurgeon these 18 months and I'm really good at it. And you know what? I just got bored with that. I want to do cardiothoracic next.
I understand. They can change
the
the
problem.
Yeah. But it's not so much so in acute care, whether it's emergency room or in the pediatrics office, because there's so many things. A fever is never a fever. A fever could just be influenza today. It could be strep tomorrow. It could be
the next
diarrhea. It could be a drug reaction. And that becomes so much trickier. And I think I learned this a long time ago in '89 in Chicago. The nurse practitioners that were in the NICU, they're very good at it. They have a limited disease. They have sepsis, jaundice, prematurity.
See, that's about it. Yeah.
That's about it. And they do that every day and they're very closely supervising the patient's not going home. And you can't teach if you were a general pediatrician doing a lot of type 1 diabetes, which doesn't happen anymore. You could definitely train a PA or a nurse practitioner, and they could do a lot of the follow-ups, and you could work with them. It's asthma, same thing. It's just over and over again, education, doing the same thing, following these parameters. It's trickier when here's a kid with a limp. What is it? A broken?
Yeah, but see, theoretically, that patient would then be bumped to your schedule.
Absolutely. And so if you do that,
the whole point.
if you do, that's great. A lot of practices don't do that. We've taken a lot of your time. I could talk to you for another 3 hours. I could turn it into a Joe Rogan podcast, but
this month I'd be happy to have a conversation with you anytime. So
you're right. But I got to catch a plane. You probably have to go see patients.
Yeah.
So thank you very much for your time. It's wonderful to see you again. And I'm hoping that I will be at Traverse City's meeting next year.
Oh, good. That'd be fun. Yeah.
All right.
Great.
Thank you so much. Bye-bye.
Thanks so much.